Now, in order of integrative medicine, we have issues like low back issues, sciatica. We have the normal injury to the neck, whiplash disorders. Our goal is to bring it and tie it together to understand the disorders. For example, when you hear sciatica, people may understand that they believe that that's a disorder. Well, it's a syndrome. It's a disorder that has hundreds of different causes, from a simple piriformis syndrome to an entrapment disorder to a spinal lesion, a herniated disc. There's a lot of reasons that someone may have what we call sciatica. Relating that, and we can also understand that someone that's under stress has a flare-up of sciatica. Someone with sciatica has intestinal issues. How do we relate that? Well, a good doctor can and kind of figure out what's going on. What we're trying to do here today is to evaluate what it is that we do in our particular practice and allow the doctors around everywhere to understand that there is a huge gamut and a huge disconnect if we believe that joint-related problems stay with joint-related problems. Anyone here can tell you that if they have a knee problem, they have a neck problem many times if it's chronic and prolonged. If they have an ankle problem, well, you can tell you that the opposite hip may have issues. Now, someone who's an athlete who is extreme and really calibrated well may be able to tell you right away, you know what, my knee hurts and now my back is hurting. That correlation is very, very understood by someone who uses their body in extreme ways. But for the average individual, the mom, the dad, the grandma that doesn't understand that or doesn't understand the logic of the connectivity, we are here to kind of expel disorder, actually myths, and kind of bring it together so that everyone understands, and bring in the type of specialist, such as an orthopedist, that can work on the meniscus and work with chiropractors and physical therapy, massage therapists, and actually come up to the right treatment protocols. Using the example of surgeries, we are non-surgical specialists. We are the ones that basically see people before surgery. A new clinical study has demonstrated today that recently just actually posted that 25% of chiropractors that send to an orthopedic surgeon actually get surgery. Yet, almost 95% of referrals from an allopathic medicine doctor do not need surgery. What does that mean? That chiropractors in general, or physical medicine doctors that work on these issues, can filter out the disorders before they need actually surgical intervention. This is just a concept that is just out there. It seems like it's a little bit abstract in the concepts, but actually determining what is surgical is important, because a lot of people don't need surgery. That's one of the things. Do they need autoimmune medicines? Maybe. The idea is that we have to work with rheumatologists and specialists that work on different disorders to come up what is best for the patient and what is necessary. Not necessarily always do we need surgery, and not necessarily always do we need medications. We've learned the consequence of medication. We've learned the consequence that every medication has a side effect. Sometimes when you take 2, well, sometimes you can understand what the side effects are. But when you start taking 3, 4, 5, 6, 10, 15 at times, even a pharmacy of stuff, you really don't know what the side effects are, and may be causing other issues like emotional issues, neurological issues, neurodegenerative disorders. It crisscrosses. So the best way to do it is to have a unified treatment protocol with multiple different providers treating an issue. Now, I have a great panel here, and what we're going to be discussing is what we do in our particular office. And what we do in our office is determine what's best for the patient, with putting a whole team around them, from orthopedists to neurologists, to figure out what integrative medicine is about. Because there is a place, and modern medicine requires integrative medicine in whole health and in whole fitness. So we are today in a wonderful site located here in El Paso. We're in a beautiful fitness facility, actually, where we treat athletes. Some of the top athletes work in this very building that we're in, that are actually young kids from 4 to 5 years old, when they can pay attention, to the Division I athletes, and some even deciding to be Olympic, candidates. So when you see athletes and you understand the dynamic movements, going through their injury processes is a whole body assessment that we have to figure out. It's a lifetime change, and it's a lifetime assessment. So having great doctors is very important. I'm glad to say that we have a lot here and a lot around the country. So what we have to do is actually bring up the awareness as to why we treat the motion issues, okay? Now, beyond motion, one of the common parallels that we have is inflammation. Inflammation seems to be one of the lines, the things that kind of connect every one of these disorders into one disorder to the other, whether it's rheumatoid, inflammation, diabetes, inflammation.